Hello, my name is Trevor Deering, and I'm going to be talking to you about ALS, or Lou Gehrig's disease. So, first off, why I chose this topic is because my grandpa, Daniel, he actually passed away with ALS, or Lou Gehrig's disease, and I was not alive when he passed away with this, but I've heard many stories about this man, and I wish very often that I could have met him. And I just really wanted to learn a lot more about this very devastating disease, as I've heard many stories about how hard it is to see someone you love just the definition of passing away. And here he is right here. So what actually is ALS? So ALS, or amyotrophic lateral sclerosis. So from Mayo Clinic, it is a nervous system disease that weakens muscles and impacts physical function. And right here you can see a normal one and a bad muscle. So the normal muscle is really healthy and it can contract and your body can tell it what to do. But when you have ALS, your brain and your spine and your cervical, they really can't perform as well as it should be. So it says right here that the muscle is unable to contract, and that's a nervous sclerosis. And this is really how ALS works, is it's through this damaged muscle. So why is it referred to Lou Gehrig's disease and not ALS all the time? Lou Gehrig was a professional baseball player for the Yankees way back in the early 1920s with Babe Ruth. So baseball was almost at its peak. Everybody was watching it. Everybody loved this team. And this man was amazing. Everything I have researched on and heard about him, he was one of the best guys you'd ever meet. And he came down with this horrible disease. And when he figured out he had it, it forced him into retirement, and he gave the luckiest man on the face of the earth speech. This speech really rocked the world, and it was extremely powerful, and he talked about how even though he had a little bit of a setback, he still was the luckiest man in the world, as he played for the Yankees and all these people loved him. So Lou Gehrig, he really shed a positive, or not a positive, but a better light on ALS, and it spread awareness to it. So discovery of ALS and the diagnosis. So in 1869, a French neurologist named Jean-Martin Charcot discovered it, which it really was not known about in the late 1860s. But when Lou Gehrig in the early 1920s got it, it really became more aware of, and that's really when it was discovered by most of the people. But the way they diagnosed it was they used multiple muscle and imaging tests, and physicians use symptoms, tests, and a full medical history in order to figure out if you have ALS. So it's not one test, or it's not one symptom that tells you you have ALS. It's a really big breakdown of your medical history and a lot of tests that go into figuring out if you have ALS. So who gets ALS? Usually people between 40 and 70 years old, but not limited to that. It is extremely uncommon, but people from 20 to 30 years old could also get this disease. But as you get older, 20% in men usually get this, between 40 and 70, but as you get older, it becomes more even between men and women. And then for some reason, which is unknown so far, military are more prone to getting this than the general public. They're still researching on how and why that's a thing. And I got all of this from hss.edu. So the symptoms, first of all, here's Stephen Hawking. He's one of the many famous people that got this terrible disease, but he actually lived for a pretty long while with it. So some symptoms are muscle twitches, cramps, tight and stiff muscles, muscle weakness, slurred speech, and a difficult chewing and swallowing. So like I was describing before, your brain and your spine connect to all your nerves, and when the muscles become irregular and damaged, your brain can't tell them exactly what to do. And because these muscles are weakened, it really messes with your life. Like your stiff muscles, you basically can't walk anymore. You can't go to the bathroom in the middle of the night. Slurred speech, you can't speak as well as you could before, and you have a difficulty chewing and swallowing. So it's just a really devastating symptoms. And as it progresses, and this disease is very aggressive, I'll talk about that more later, but it becomes harder to move, harder to eat, speak, and even breathe. Eventually, you will have to live on some type of breathing machine, just because breathing becomes so hard because there's so many muscles in your body and your organs. Another fact about the symptoms is people with ALS burn calories extremely fast and they lose weight rapidly. And this is because they can't eat normally, and just how aggressive this disease is. So when you're losing this amount of weight so fast, you have to take so many pills and IVs just to keep your nutrition up. And the rate of symptoms vary from person to person. So one person's symptoms could dramatically be faster than another person that has ALS. And this all came from NINS.gov. So what actually happens to the body? So the motor neurons attach from the brain to the spinal cord and to the muscles throughout the body. So from your brain down to your spinal cord and all throughout your muscles. So from my brain to my spinal cord goes to my arm muscles, my leg muscles, my face, everything. And they give your voluntary movements and your muscle control. So ALS causes these motor neurons to degenerate, which is why the muscle function in the rest of your body makes it so difficult to do the things like ability to eat, speak, move, and breathe. And this all came from ALS.org. So what are your treatment plans? First of all, I'd like to state there is no cure, and it has been in progress of finding a cure for a very long time, but they still have not found one, which is extremely sad. But the pain medications and medications that help slow down the disease are the two main ones, just to try and prolong their life and not make them hurt as much. Physical and occupational therapy, because of course you can't move as well as you would have if you didn't have ALS, so these two really help you learn to live with the disease and move. Communications, because your speech becomes more slurred, so you have to kind of relearn how to talk. Your breathing and nutritional support, like I said, they lose weight extremely fast, so the nutrition is very important. And then BCI, which is brain-computer interface, and you can see this in the picture right here. It's where your brain is pretty much hooked up to a computer, and if you've ever seen Stephen Hawking, you know he can talk through a computer, and that's because he thinks about what he wants to say and what he wants to do, and the computer will do it for him, which I think is brilliant, and I really don't understand how it works, but I think that's just awesome for these ALS patients. So their time to live so it depends on the patient and how aggressive this disease is, and it's usually from 2 to 5, but it's not limited to 10 years or longer, which really is not that long at all for this disease, and it would be a very, very long 2 to 5 years to live with this disease, and also your loved ones. So how many people are affected each year? So less than 20,000 US cases per year is what I found, and in 2016 it was projected that a little over 200,000 people had ALS worldwide, including the US, and this all came from ncbi.gov. I was not able to find anything more recent, so I just included the most recent one I could find. So finally, I feel like everyone should know what the ALS Ice Bucket Challenge was. In 2014, it's when it started, and that's when you would take a bucket of ice and you dump it over your head, and you would donate how much money you could to the ALS Foundation, which was trying to find a cure. This almost became, it was pretty much a trend where celebrities and everyone on Snapchat, Instagram, they were all nominating people to do the Ice Bucket Challenge, and this spread like wildfire. Everybody was doing the ALS Bucket Challenge, and this resulted in $115 million raised, which is an incredible number. And I also participated myself. I could not find the video of me doing it though. So I just want to thank you for listening. Here are my sources, and thank you.